All right, everybody, Dr. Rafich here from Vet Triage. We are going through this issue of JAVMA. It is from October 2016, and we're going to be talking about technicians. Technician problem shortage may be a problem of turnover instead. Income wellness issues plague veterinary technicians, survey says. So, low pay and compassion fatigue and burnout, as well as lack of recognition and career advancement, remain ongoing concerns. That's according to a 2016 National Association of Veterinary Technicians in America survey, and this is their website here for this organization that is supposed to help the veterinary technician community. Further, technicians identified office dynamics and communication 40%, client non-compliance 39%, and lack of resources within the clinic 11% as the greatest challenges they face in practice. 51% said they are very satisfied with their career. A quarter of respondents have worked for their current employer for 1 to 3 years. 56.7% had changed their place of employment within the first 5 years. Now, in regards to reducing turnover, the problem isn't a shortage of technicians, but one of team retention, lack of career growth within veterinary practices and hospitals generally being undermanaged. Technicians on average are being paid $14 to $16 an hour, and keep in mind this is in 2016, it has improved since then. According to the survey, most technicians work 30 to 40 hours per week, making up 43% of respondents, followed by 40 to 50 hours per week, which is 37.6% of respondents. Full-time technicians report a salary between $15 to $20 per hour at 44% of technicians who responded, or $31,200 to $41,600 for an annual salary of 40 hours per week, whereas part-time makes $14 to $16 per hour at 29% of respondents, or $14,560 to $16,640 for an annual salary at 20 hours a week of work. In comparison, the poverty line in the United States in 2016 was $24,300. Technicians don't feel they are part of a whole, working for a common purpose, or don't enjoy working with their coworkers. More than 80% of respondents to the survey said they receive paid vacation and discounted pet care as a benefit. Further, 70% have health insurance, continuing education, associated expense reimbursements, and paid holidays. 60% have a retirement plan to which they can contribute, as well as paid sick days. 50% receive dental insurance and time off for continuing education. Less than 40% receive paid licensing fees, life insurance, disability insurance, paid association membership fees, or a uniform allowance. The veterinary industry has twice the rate of turnover as comparable industries. A few practices average a 15% turnover, but others may see a rate of 33 to 50%. The AHA, American Animal Health Hospital Association Compensation and Benefits book reported a mean practice turnover of 21% overall. Respondents report a 22% turnover rate for veterinary technicians and a 31% turnover rate for other staff. 45% indicate that they have left the veterinary profession, and top reasons for leaving include low pay at 38%, lack of respect from the employer at 20%, and burnout at 14%. Results show that the typical veterinarian's gross income increased by $93,311 for each credentialed veterinary technician per veterinarian in the practice. And I think typically you want to have 4 technicians per doctor in the practice, ideally, for the most efficiency. So it makes sense that the more technicians you add, the more money will come to the practice. And since veterinarians are production based, they'll make more money. Technicians reported talking to clients regarding medication administration at 79%, followed by correct care for patients at 71%, treatment protocol 64%, and pain management at 56%. Most comfortable educating clients on medication administration, while least comfortable topics include nutrition, diabetes management, and hospice care. Opinion counts when it comes to equipment at 98%, pain management at 60%, anesthesia at 60%. Nursing care was far behind at 8%, followed by management topics at 5%. Technicians estimated that they made recommendations to clients 60% of the time and thought 69% of clients accepted them most of the time. 28% cited clients follow recommendations occasionally, and 3% always. For those who indicated clients did not accept recommendations, 38% thought price was the barrier in most cases. 52% thought it was occasionally the problem, and 5% said it was always a problem. Regarding wellness, 23% of practices offered support for team members experiencing compassion fatigue. 2% said a fellow coworker has committed suicide, and only 3% of those respondents had grief counseling provided to the team. The most fulfilling aspects of the job are caring for animals in the best way possible, making a difference in a pet's life, assisting in diagnosing, and staying current on the science and technology of medicine. The least fulfilling aspects was lack of support from management. Additional staff members would help at 45%, followed by increasing client compliance at 43%. 32% would like to have more continuing education opportunities, and 23% would like more advanced diagnostic tools to be used in the practice. And then this second article here is focused on technicians revamping the credential system and their title. So again, the National Association of Veterinary Technicians in America was trying to figure out if we should consolidate the name of technicians. It's different everywhere in the world. Registered veterinary nurse is used in the United Kingdom and Australia. That seems to be favored by this organization. Right now, there are 4 titles that exist. 13 states don't require veterinary technicians to be credentialed. States vary in their education and maintenance requirements for technicians to be credentialed, as well as scope of practice. Some states do not have veterinary technicians included in their Veterinary Practice Act. And this lack of standardization is annoying in the field, and it probably happens in other fields as well. But the veterinary field, for some reason, just cannot come together and homogenize the entire U.S. It's very dumb. A recent survey of veterinary technicians by the organization showed that 97.3% were in favor of a national standardized credential requirements, and 73.3% were in favor of changing the title to veterinary nurse. In 2016, this organization survey also asked questions about a national standardized credential requirement. 90% of respondents said it was important to them, and 90% agreed that a standard or same title was important. 54% said they prefer veterinary nurse, 38% prefer veterinary technician, 8% were undecided. Among those employed as veterinary technicians, 83.4% indicated being credentialed, while 11.6% were non-credentialed, 3.5% were veterinary assistants. And then finally, there was a 13th veterinary technician specialty created. So for those who don't know, at some point in the evolution for veterinary technicians, they created veterinary technician specialties, which I thought was a smart move, a move in the right direction, assuming you give them education, maintain their education after they get the title, and not only do their responsibilities go up, but also their pay go up. And it seems like, based on recent events with the mid-level practitioner, I'm guessing that the veterinary technician specialty system created was a flop in terms of trying to keep veterinary technicians interested in staying in the field and in trying to entice folks who want to be technicians to come join the field. The National Association of Veterinary Technicians in America announced in August 16, this is 2016, that the Academy of Veterinary Ophthalmologic Technicians is the latest veterinary technician specialty academy. Ophthalmology technician responsibilities include assisting veterinarians with ocular exams, performing or assisting with diagnostic testing, such as Schirmer tear testing or tonometry, providing anesthetic care, and caring for ophthalmologic instrumentation and equipment. The existing 12 specialties include dentistry, anesthesia, internal medicine, emergency and critical care, equine nursing, zoologic medicine, surgery, behavior, clinical practice, nutrition, clinical pathology, and dermatology. There were 924 veterinary technician specialists as of 2015. So, the discussions continue with veterinary technicians. I don't agree entirely with this article in terms of there not being a veterinary technician shortage. Now, obviously, again, I'm talking about right now, but these problems clearly lead to a shortage, right? I mean, if you don't pay them enough and they don't feel that they're valued in the workplace, not supported in every way, not just emotionally, but also professionally, why the hell would they stay, and why would people even join the profession? There's a cap, a ceiling to how much you can pay them, because the responsibilities cap out. And if you promote them, let's say to the next level, which in most hospitals becomes a hospital manager or practice manager, they're no longer working with animals, and defeats the whole purpose of what makes them passionate about being veterinary technicians. So you can offer them more pay, more responsibilities as far as being in management, but they didn't go into the field to manage people. They went to the field to take care of animals. So the mid-level practitioner, for as new as it is still I like it because we're trying something new. That's the point. All the other things we've tried are not working. They failed, and clearly the veterinary community is not willing to pay them more for the same responsibilities. So you have to do something different. So I'm in favor for things that are even considered radical, because at least we're doing something. If anybody has a better idea, I mean, too late, but please say it, because folks have been fighting with this issue for decades, largely either throwing out bad ideas or taking ideas and not really implementing them, or ignoring the problems altogether. So the mid-level practitioner, at least, is something new to add to the field. Yes, it needs to be regulated, and there's going to be issues with it, and it's going to have to evolve. There has to be guidelines and rules and all this stuff, like anything else that's new. So the naysayers of this, what I challenge you to do is offer an opinion that actually can help the veterinary technician problem. Otherwise, move out of the way so we can try something new, because the old things haven't worked. Thanks for supporting the channel. We'll see you in the next one. Take care.